Hello, my name is Professor Gary Sibbald. I'm a professor of public health and medicine at the University of Toronto. I'm the course coordinator of the IIWCC, International Interprofessional Wound Care course with the University of Toronto and with sites in Toronto and Abu Dhabi. This meeting, the World Union of Wound Healing Societies, is really a culmination of a journey of many women. It started with Dr. Afsaneh Alavi, who was actually very, very important in terms of being a fellow in wound care, subsequently got a dermatology position and retrained at the University of Toronto, and brought us to Tehran, Iran, where Gulnaz was a student in the IIWCC. We thought it was overly ambitious for Gulnaz for her selective, decide that she would bring the IIWCC to Abu Dhabi, but she did it. And it's telling people the impossible is possible. Gulnaz then went on her journey to actually encourage other women to get involved and to be engaged. And she's really done a great job of that, leading to the culmination of being the first nurse as president of the World Union of Wound Healing Societies. Back in 2008, when I was the president of the World Union, there was a bid from South Africa. And this is where Hiski's story starts. And Hiski really has been a great trailblazer in terms of bringing the IIWCC after taking the course in Toronto. Her selective was the best selective on the Africa Bandage, and Phoebe is now going to do that and further that work as a PhD. And certainly Hiski's journey from South Africa took her to be a member of the faculty, as was Gulnaz and was Afsaneh within the IIWCC course. Hiski then went to the Kingdom of Bahrain, created a foot program. The journey continued, and Hiski really has been the Secretary General of this meeting and has really completed the full cycle of being an international key opinion leader and being able to manage to deliver to other people and to bring other people into leadership quality. Dr. Alavi is now at the Mayo Clinic. Dr. Bharat Kortru from India has become part of the faculty as a podiatrist, so that we're really modeling interprofessional care that goes from the doctor, the nurse, and the interprofessional, all being considered equal in the same playing field. From Africa, we also have Dr. Helen Yifter. Helen was a graduate of the course starting in South Africa and then Abu Dhabi, but Helen set up a diabetic foot clinic at Addis Ababa University and Black Lion Hospital. And Helen then went on to be a co-director of the academy and had a great influence on wound healing teaching within the continuum. So I think these individuals, all graduates of the IIWCC, all mentees, have really made a difference, and I think their journey is our journey, and I think much more can happen. And we need to look at COVID as an opportunity. The course has gone completely virtual, probably a blended model in the future, but we have virtual skills, and these skills will identify the skills for each and every individual within the course. And then there's Project ECHO Skin and Wound, Extension for Community Healthcare Outcomes. And Project ECHO is going to make a difference. It'll model interprofessional care. There will be a stream for leg and foot ulcers, so this will be the diabetic foot. It will help teams to give integrated, coordinated care. We think we're on the verge of changing the lives of people everywhere with education, innovation, and new thinking. And actually within the healthcare systems, we actually have to realize with the Porter model, with less money we can do more. It's value for the healthcare dollar. It starts with the patient, but it involves the healthcare professional. But we've also got to get help from the payers and the providers, in addition the policymakers and the politicians. We can bring everybody together and this world can be a better place. We hope you'll join the journey. we hope you'll change the lives of patients with wounds. Thank you.